And we know that it's going to be a very engaging and insightful session. So we have as usual, we have our pre and post test, which we would like. I would like Ms. Olorunrinu to kindly share with us the pre and post test, so that let's all of us attempt these questions, so that we can really, really know why we are here and be able to assess how much we have, gained after the podcast. So, Ms. Olorunrinu, ma, please, ma, can you share the pre and post tests? Thank you, ma. Ms. Olorunrinu, are you on the call? She's there. Ms. Olorunrinu. Hello, Ms. Olorunrinu. I'm not sure if she's on. Yes, ma.
Can you hear me?
Yes, I can.
Okay, ma. Okay, so I think it's something we'll have to do on our council platform for now.
Okay. All right. Okay. So please, can we all attempt these questions? There are 5 questions as usual. So they are the pre-test, and then after the podcast, we'll be sending the same questions out again, and we expect everyone to attempt it. So please, ma, kindly do this for the next 5 minutes. Ms. Olorunrinu, please, the questions are not there.
Do you see them now? Sent as received.
Okay. All right, thank you. So please, can we all attempt these questions? Just 5 questions, and please select the best option. So number 1, A, number 2, B, that kind of thing. Please let us all attempt these questions.
Hello?
We can't see any question, please.
It's on the official platform.
On the official platform. It's going to be difficult. It's going to be difficult for them to be able for us to be able to assess the questions like that. We need to type it into the poll if it's going to make sense. We need to know what responses people are giving. So the way we have gone about this one, I think you may need to just proceed with the lecture.
All right, ma.
Yeah. That's the way it is. I'll try and see if I can do the poll for the post test on it and type it into the
okay,
for the post test. Yeah.
Thank you, ma. Okay, ma. So Dr. Tolufa Gorala, ma, over to you, ma.
Yes, can you put on my slides? Thank you. My slides?
You can share your slides, ma.
I've sent it to you. From here, I can't do that.
Oh, okay.
That's why I've sent it. I've sent it to you ahead.
All right. I can
send it.
I can do that, ma.
Please.
Okay, I'll do that. I'm looking for them slides. Okay.
Have you got them?
Yes, can I share the...
Yes, please go ahead so I can start. Thank you.
Okay. Can you all see my screen?
Yes, we can.
Okay,
Yes,
ma'am.
I can.
Okay, ma'am.
I
So
can.
go ahead, ma'am.
Okay, fine. Good evening. Thank you so much for the honor to do this presentation. I thank everybody. It's a part of our life that in Africa, we don't normally talk about this. And so I'm happy to talk about it. Okay, fine. It's under normal aging and coping mechanisms. And I'm to talk about optimizing sexual health. Many of us that grew up in Nigeria when we were young, we don't talk about sex or sexual health, but we have gotten to that stage we need to address it. So I put it under different headings, but let me move fast. I'm not going to waste time. So I'm talking, bottom line, as we age, physical, hormonal, emotional, and social changes can affect sexual health. However, understanding the shifts, the changes, and adopting an effective coping strategy, it can help us to maintain a healthy, fine life. So, sexual health. Sexual health is a state of emotional, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexual relationships, and then having pleasurable, safe sexual experience free of coercion. Thank you for moving that up. Free of coercion, discrimination, and violence. That is just sexual health. It's a big area. As I said, state of emotional, mental, social well-being, positive respective, sexual relationships, and having pleasurable, safe sexual experience. Please move up my slide. Can you move it up? Thank you. Yes. Okay, now I'm going to the next one. Yes, normal. The pictures here is not showing.
Okay, just a minute, ma'am.
I put everything in the normal age-related changes affecting sexual health. There's a colored circular option, giving all my options there. I'll go ahead. Now, in our aging, we have different changes occurring both in men and women. So as we age, we have different changes. A major area is hormonal changes. That's one. Hormonal changes in the men, testosterone level drops. And what does that do to them? It reduces their libido. Many of them also have erectile dysfunction. We should all wake up to that. And in about 70% of men between age 40 to 70, they experience erectile dysfunction. So because of that, some of our men get worried when they find out that, they're having problems with erection, penile erection, penis erection. They're having problems with it. They actually get worried. It affects them psychologically. It affects them in so many different ways. But it's a major aspect that we see in men. So the important thing, once they know that it's something that occurs when they're aging, they're not going to be so tense and worried. That's one aspect. In women, we have the hormonal change too, which is reduction in the estrogen levels. And we have that in menopausal women. Not all women. You know, we all have different ages, from young, teenage, young adult, and then when we get to menopause. Now, the reduction in estrogen is common in the menopausal women. And that's a major area. Okay, so what does that reduction in estrogen does? They have what we call vaginal dryness, It causes thinning of the vaginal walls, and they also have reduced libido. That means they lack the urge for sex. And when that happens, when they're having vaginal dryness, what occurs? So when they have sex, they're going to have painful sex. Dyspareunia, we call it dyspareunia in medical language. They have painful sex. And then some might have vaginal bleeding or itching or infection. However, when women, especially menopausal women, are having painful sex, they get worried that there's something wrong with their bodies. No, it is all an age-related change. Everywhere I go now, I talk to people that are my age. I talk to both husband and wife. You know, it's important that men are here. So once they understand what is going on with women, they will adapt and they can cope. And then the marriages don't break down, because we all know that sex and money breaks down marriages. Okay, now I'm going to the physical changes. As we age too, physical changes occur. And what are these physical changes? You know, with age, people pick up some chronic illnesses, hypertension, diabetes, arthritis, heart disease. And when those occur, that also affects sexual health. Because, yes, thank you, that's it. That's what I want. Yeah, thank you. Now, I'm talking on the physical changes. So that also, and then the medications we're on. I am hypertensive. So medications we're on for both men and women, some of the hypertensive medications reduce our sexual urge. That means it drops our libido. Some medications too, antidepressants and other medications. So it's important to know what can cause those changes, and then we discuss with our doctors. Now, psychologically. Now, that's the next cycle. No, leave me here, leave me here. Yeah, the next cycle is psychologically. That's the brown box. Okay. Psychological, I'm talking about age-related changes. I've talked about hormone changes. I've talked about physical changes. Now I'm talking about psychologically. Now, psychologically, as we age, there are a lot of problems. We are stressed, both men and women. Stressed. Right now, in Nigeria of today, many of us are stressed. I'll talk about what I do to reduce my stress later at the end. I hope I remember to say that. So it's up for us to devise means of reducing the stress. We're stressed, we're anxious, we're worried about children, worried about husband, worried about family, we're depressed. And all this affects all of us, both men and women, and it reduces our sexual urge. That means interest in sex. We're not interested in having sex anymore. Same goes for both men and women. Now, the other aspect of the psychology, we can talk about self-esteem, our body image. You know, many of us are lacking confidence. We're lacking self-esteem. For example, with age, many of us, like me, have added weight. I'm not as tiny as before. So I'm bothered about it that am I as good looking as before? It's affecting everybody. So confidence, self-esteem, and that confidence in your body image. All this also affects our libido. Libido means urge for sex. Now, previous psychological problems have been raised in the past, and these occur to our teenage. When we see that occurring, we need to get them to counseling. History of rape, it affects sexual urge. Thank God that we now have IDERA sexual assault centers. We have in general hospitals, which was organized by the First Lady, and that is going a long way. I've handled patients in the past. You'll be shocked at what I tell you. I've handled young ones, age 2, age 5, age 8, 10, who have been sexually molested, and usually by people they know, family members. Now, such children, there's no how. Eventually, they're going to have problems with sex. But if they're adequately handled and counseled now, they won't have that. Okay, now social and relationship factors is the next box. What I mean by that, relationship, loss of a partner, a woman becomes a widow, a man becomes a widower, it affects sexual urge. It affects our sexual health. Many of us women too were under a lot of pressure, caregiving responsibilities, as in taking care of our elderly parents, both on our side and the husband's side. We're doing all that. And then changes in relationship dynamics. All this reduce the desire for sexual activity. Okay, now here I highlighted problems in menopausal women because I know many of us here are in the menopause, so we need to know some of the changes. I can't talk about it all, it's a big topic, but this one, which is the area where we have sex, I'll just talk about this for both men and women. In women, problems in them, vaginal dryness, vaginal tightness, vaginal wall, thinning of the vaginal walls, and then all this results in painful sex, loss of libido, reduced sexual drive, then vulva. A lot of women are scratching their vulva and vagina, and they're thinking is infection, is infection. The another aspect, which is a broad area, is incontinence. That is leakage of urine. It is affecting a lot of women. We hide it, but we need to talk about it. We need to address it and sort it out. But I can't talk about that. That area too is big, but that also occurs in men. So incontinence is a big problem for many women. Maybe those that have had surgery or they had difficult labor in the past or different things. And they just find out that they're going to urine, the urine is already out. When they cough, urine is staining their pants or feces is coming out. So all that, those are all problems. And those affect our self-esteem. And all these affect sexual drive. So we feel, the other one moves near you. I'm not interested, leave me alone. Those are the things affecting. Now, what are the other problems in men that we see? Hold on, just wait there. Thank you. Just stay here. Thank you. In men, just leave it at here. Thank you. Now, in men, I didn't put the men one here, but I just mentioned because I realized there'll be men here. Reduced libido. Yes, it's normal as we age. You find out that a married couple before they could have sex 5 times a week or every day, or even 3 times in one day. And then as they age, like people like us above age 50, you now find out, you're not interested. Sometimes you might not even have sex in a month or 2 months. Yeah, it's normal. The drive is no longer there. But the bottom line is if we identify that it's a normal aging process, but we know how to address it, we can still have a pleasurable sexual life. Now in men, they also have reduced penile erection. It happens in many of them. And that's why many of them, they're really honest with you. That's why sometimes they go around because it's affecting them psychologically. That, what's this? In Yoruba, I'll say it, Okoyo lemona. They will try it elsewhere. That maybe it's the wife that there's a problem. Then they go out to try it. And when they try outside, sometimes they get trapped. We all know. Let's leave that. But it is a part of aging that can occur. It's all about knowing it and then knowing how to address it and adapt to it. Many of them have what we call erectile dysfunction. And there's treatment for this thing. There are medications for it, for erectile dysfunction. They also have premature ejaculation. Yes, it's happening. It's important we know. Once we know, then we adjust. Incontinence, and then there's an aspect now that is big, prostate enlargement. They're having that. All that is affecting sexual health. Now I'm going to the coping mechanisms. Now, coping mechanisms, I put it in different boxes. I hope we can see it, but I'll go. The first box, that's the orange box, is talking about open communication. We need to talk. Many of us, the way we're brought up, we don't talk about sex. Even with your husband, you might not discuss it. Open communication. So we talk, open communication means talking with your partner about your desires, your needs, the changes that are occurring, and how to adapt and adjust and live with it. Okay? And then knowing that, okay, frequency of sex is not like before, I can't do every day, but we can still do. And those are things that, and they need to adjust. Now, for the younger couples, do you realize many of us don't know? We're all parents. I've handled many young couples who've been married 6 months, 1 year, and could not have sex. Thank God they opened up to me. They couldn't have sex. I hope we can hear me. They couldn't have sex. I've handled many like that. And I thank God I've been successful. I was able to put them through and talk to both at the same time in privacy, in the clinic. And in government hospital, it's difficult to do that. You can't have that privacy. I won't lie, but I've handled many. Honestly, so don't be shocked. There's so many conditions in women that there's something called vaginismus. So it's all about reading, knowing about all these things. Young couples. So churches counsel them for the marriage, but I think we might need to do more. I wouldn't say more than that. Now, older people like us, we must talk. I tell your husband, yeah, well, that is not like before, but once he knows the changes in your body, he too can adjust. Okay, now medical consultation is the next box. Under the coping mechanisms, medical consultation. Now, what am I talking about? Medical consultation means seeing your doctor, address all the health issues, address the medications which I've mentioned can reduce libido. Then if there are any sexually transmitted infections, you treat it, and that's that. Under medical consultation, so there's something we call hormone replacement therapy, which we use for menopausal women. And so once we know all these things are available, and that one helps us to elevate the estrogen, it provides estrogen again, and then the body goes back a bit. And there are other things. It comes in different forms. I'm not going to waste time there. Now, for the men, when they're noticing erectile dysfunction, or it is advisable to see the urologist. We have urologists now, and they have all privacy with them. Those ones will treat them. There are things they might find there, and if they don't find anything, there are medications for it. However, those medications must be used under supervision. There are many medications for erection outside. So many, Viagra, Tadalafil, there's so many. But I'm not going to say all the names here so that we don't just go and buy them ourselves, because all these medications have to be used with under supervision. So those having erectile dysfunction, they can be treated. I have couples too, young couples who didn't know, and they had erectile dysfunction, and it was being hidden. They couldn't talk about it. Some married for years and did have sex. But all these ones, they are alert and realize that there's treatment. And there's no shame. That's the way I'm going to go. There's always that shame tag. No, there's no shame to it. Okay, so they get help. Now, under coping mechanisms also, I have the next one is the lubricant. It's under coping. How do we cope? This for the elderly like us, above 50. There are lubricants. There are vaginal lubricants available, and moisturizers. They are available. It is good to ask your doctor for them. When you travel, you can buy. There's some in the country, but not as many as we want, but it's available. If you talk to a gynecologist, and all that will help lubrication, the vaginal dryness you're having, and then the sex will no longer be painful. Once we're using the moisturizer, we put it in. The lubricant, we use that for sex. I've counseled many people on that. I tell them they can there's one common one here, is the water-based lubricant, KY jelly. We all know KY jelly. Just get it, put it by your bedside. So when it's time for action, you tell your husband that, that place is dry and it will be painful for me. We'll use this KY jelly. Yes, all these are available. Or you can use condom. Condom also has a lubricant on it. And then it makes the sex more possible and less painful. All these are available. Sometimes we have to put women on what we call estrogen cream, estrogenize that area, because it's the reduction in estrogen that is making all that place tight. And they now have painful sex. Different types of lubricants are available, all available. If you check it online, you'll find. Now, the other coping mechanism, physical activity, regular exercise, that helps all of us, for both men and women. Regular exercise, nothing strenuous, walking, simple exercises, because it increases blood circulation to all those areas. And then it helps us with now, and it also helps us affect our mood and energy. All that affects sexual activity. Okay, mental health support. People look at it, mental health support, why do I need? Oh yes, we have psychologists in the country now. We have many. Before it was just psychiatrists. And once you mention psychiatrists, everybody's like, it's a stigma thing. No, counseling now is needed. Everybody needs. It goes a long way. It helps. So if somebody having depression or under a lot of stress can see a psychologist, yes, it goes a long way, and that affects sexual health. Those are all the way of coping. There's also sex therapists. Whether they are available in the country, that I'm not sure. But I believe we've gone a long way. We might have that. People who can talk about sex. Okay, now intimacy use is the next under coping mechanisms. Now, as we get older, as I mentioned, you can have sex like before, and there's a part of intimacy that many of us miss. Just a hugging, the man hugging the woman, the man just touching her, and it's not sexual health is not as if it's unless you have sexual intercourse, then you are not okay sexually. No, hugging, touching, and then just kissing on the cheek or something, always regularly touching the person, is also fondling, massaging, is also part of intimacy that we can use as coping mechanism when we feel we can't have sex. The other one is, the other coping mechanism now in the gray box, it says adaptive and realistic expectation. Is for us to adapt. We should wake up to the fact that there are changes, and the changes are there as we age. So we adapt, and we can accept the sexual pattern, accept that our sexual patterns may change. Now, let me give you an example. Many of the men that have this terrible back problem, they're having, you and I know a lot of orthopedic problems are there as we age. Sometimes you might have to change the position of sex. So if the woman knows, then she will accept it. Because the man will say, physiotherapy says we can't do it this way because of this, my terrible back and leg problem. We can do it the other way. Some women will dodge. No, it's just about changing. So your mindset, you have to accept and adapt that there are changes as you age, and there are also going to be changes in the patterns of sex. The other thing under adaptation is shift from performance. As I said, it doesn't have to be.
Let's tell her that she will be growing and come back.
Connection and enjoyment. Please, can you switch off? Now, factors. Next, I'm going to the next slide now. Factors that, yes, thank you. Yes, thank you. Factors that contribute to good sexual health. We have the physical aspect. Under physical aspects, how do we assess and change the physical aspect? We talk about education. We're doing one now. Organizing these talks, and we're educating each other, and we're discussing, which is good. We talk about something we hide, is open. We need to talk. The other one is regular checkup. Regular checkup, as in, for example, you having routine screening for sexually transmitted infections. We feel that because we are that age, we don't need to do it. No, we can do it yearly, because our immunity is not as good as before. Our vaginal walls are thin. We're prone to infections. So we need to do that. Especially for those in polygamous relationships, it's advisable you do sexual transmitted infection screening yearly and then treat it. There's no big deal. And just treat it. At least make your body healthy. Okay, other tests we can run, all these are pap smear tests, which you all know, I talked about that before, for cervical cancer, so that if a woman is bleeding, because as I said, painful sex occurs in menopausal women, and when that occurs, we all think it's because of sex, but sometimes bleeding after sex can be that there's cervical cancer there. So that's why we need to also do all the screening, pap smear screening plus HPV. Then you have the HPV vaccine, which we're talking about for young people and up to age 45. For us older than 45, we don't need the vaccine because we've been exposed. But so long as we don't have any problem, and how do we battle it since we are not using the vaccine? Regular pap smear test, that's all. Okay, for the men, also they have to do the yearly screening for sexually transmitted infection. It's advised to do all these things. There's no big deal to it. And then there's this one, prostate-specific antigen. That's a PSA test to detect whether they are having prostate enlargement and cancer. We're seeing a lot of prostate cancer right now. So it's best to prevent, do the test regularly, and then act on it. Urologists are available in the country. They are available now. Now, under physical aspect, I'm talking about safe sex practices. Yes, safe sex practices means using condom. There's male and female condom. Anyone you're used to, there's nothing wrong in using it. We shouldn't think we're too old to use it, and it's available. And then we talk about personal hygiene. Now, this aspect, personal hygiene, I handle women. Many of us women, from when we're young, the way we clean our vagina is wrong. Many people have to clean inside the vagina. No, we don't need to. And that exposes us, makes us prone to infections. I carried out a study when I was specializing in Louth on bacterial vaginosis, and this was what I centered on. I did some tests, the way they clean the vagina, douching, putting their fingers right in. When they do that, when you clean, you can clean the vulva and in between the lips of the vulva, wash it well. But to stick hand inside vagina and clean it, you're exposing yourself. And that's why many women keep having infections. When you do that, you are changing the pH of the vagina. The vagina is not sterile. So when you alter the pH, there are normal, we call it the normal bacteria there. They are there and they are quiet. However, when you put your fingers in and sticking soap, other agents, you are changing the pH of that environment. And then what happens? Those quiet bacteria, they get wild. And then you have women always having abnormal discharge, abnormal that come with infections, and it's quite common. So personal hygiene, cleaning well, but properly is important. And I talk to women now because I'm a woman. So I also tell them aeration of that place. Please, when you get home, take off the pants and the tights. Let some air go there. You can wear your boo-boo or loose trousers or loose dress. The reason being that that place is always moist and wet, and that encourages fungal infection. So we do that in the house. I always guide women, take off the bra, take off the underwear, but wear something properly that will cover you. Aeration of those areas is good. Okay, then factors that contribute to healthy sexual health is still what I'm talking about. The emotional and psychological aspect. That's it. Yes, wait here. Thank you. Emotional and psychological. Thank you so much. Emotional and psychological consent. Yes, psychologically, we must consent to sex before we have sex. Okay, then self-esteem and body image. I've mentioned that before. The next thing is knowledge and education. I've talked about that, which is also what we're doing now, having the knowledge, knowing. And this now, you see, sexual health is not just for women to be educated. For those that are married, both the husband and wife must be educated. So they know the changes occurring in each other, and then they adjust and adapt. Okay, now sexual rights and safety. Yes, I did a course on sexual reproductive health and rights in Sweden in 2011-12, and sexual rights and safety. Everybody has sexual rights. Anybody can go the way they want. That's what's been said. Sexual rights. So a woman, but in our environment here, they have the right to have sex. And if you don't, so bottom line, freedom from coercion and violence. The other aspect on the safety is access to services that can treat us, that can counseling services or services where we can report for the menopausal changes and get treated for it. Services where we can go for family planning if we're not ready to have children, so that we can prevent unplanned pregnancies. Services where we can, like I said, rape centers now, services, we have those centers where you can complain if they notice a young child has been raped or a young girl. We have that Idera, it's there. One is in Alimosho, it's in some other centers. We also have in Laos, I know there's one, there's a counseling where you can report gender violence. It's there. So all these services must be accessible to us. Okay, now I go to the practical tips. This is this one. The first one, gray one, says stay. Thank you very much. Stay active. Stay active. That means regular exercises. Regular exercises, not heavy exercises, gentle, just taking walks. Many of us, you sit in the car in the AC from the office to the house. And you get home, you enter the sitting room, AC. The person who's helping you that does the cooking. We're all sitting. All these are causing a lot of damage. And it's not just for sexual health, also for orthopedic side. A lot of people now are battling arthritis, back pain, all sorts. So we need to get moving. Okay? It also helps with our mood. And as I said, it addresses our body image. So all this, our excessive weight, like man, the regular walking, adjusting our diet, it will shift it and make me slimmer, make you slimmer as well. Next one, healthy diet. And under healthy diet, I say healthy diet, eat healthily. These are practical tips. It supports energy, supports the hormone levels, and the cardiovascular health that we have. Then what else? We also talk about addressing mental health. That means stress reduction. We have to look for ways of reducing stress. And the therapy, we can do that with therapy, counseling, or every woman, you can create a way you can avoid stress. Like I use music when I'm stressed, I use music, or I go out, somebody's doing something, I go there, I laugh, I go to church, praise worship, all this, or I phone my friends. There's a trade fair somewhere. You people, are you interested? We all meet there, we laugh, we gist. You have to develop your ways of handling and battling stress. It goes a long way and it helps. Okay. The next one, I said medical optimization, which we have discussed. These are all practical things. Medical optimization involves going for the regular check, treat the different diseases, adjust your medications, and if there's need for hormone therapy. For the men, we use testosterone if it is needed. If it is needed, it's available. They sometimes have to put men on testosterone. For women, hormone replacement therapy, if it is necessary, that's estrogen replacement, so that it helps with the vaginal walls and that place becomes supple and soft instead of being dry, which leads to painful sex. So all those things are available. The other thing I'll mention, medical, we say sleep. Many of us don't sleep well. This is our social media, phones. It's a dangerous thing. Right now, I make sure I learned it online. Don't use your phone at least an hour before you sleep. It's because your brain is just moving, just getting active as you are using the phone. So once you know you're going to sleep by 10, by 9, stop it. Put your phone on silent, go and sleep. At our age now, you must sleep at least 7 hours. It's healthy. And we need to realize that this is important now. Many of us are seeing something in the elderly that we didn't see before. I'm sure you all know it, dementia and Alzheimer's. It's quite common now. Dementia, Alzheimer's, elderly people behaving irrationally, and then after a while, they forget everything. They don't even know their names. They don't know where they are. It's common now. So you need to start acting now so that your old age, you're not going to be like that. So we must sleep well. For the men, avoid tobacco and excess alcohol. Did you hear what I said? Avoid excess alcohol. That means they can take a bit, but they should avoid excess alcohol. Now, all those are practical tips for good sexual health. Okay, I'll just mention here, what are the benefits of good sexual health? What does it do when we have good sexual health? It gives us stronger relationships. At our age now, especially for those of us that are older, our relationships matter. Loneliness is killing a lot of elderly people. So relationships matter. We have to hold on to our relationships, either with your husband or with your wife or with good friends. Relationships matter now. Now, reduce risk of sexually transmitted infections. Yes, if you have good sexual health, reduce risk of sexually transmitted infections. We also have better mental and emotional well-being. I mentioned that now about Alzheimer's and dementia that we're seeing in our elderly people. It's bad though. So we need to act. We start acting now so that our own old age, by age 17, 80, we don't get like that. Increase, and so that will not be a burden for anybody, not a burden for our children, and we shall not be, in Jesus' name, amen. Now, increase self-esteem, increase body confidence when you have good sexual health, yeah, and improved quality of life and satisfaction when there's good sexual health. Now, it's a big topic, as I said. I've just picked on little things to give us ideas of what is going on and to understand and know that we can act. And all these things is not a shame. It's something that occurs. So in conclusion, I have talked about the importance of sexual health, the fact that as we age, our body and attitude changes, and so it affects our sexual health. So we have to adjust, use the coping mechanisms I talked about, use the practical tips I've listed, which I've highlighted, so as to have pleasurable, satisfying sexual wellness. Thank you. I must say special thanks to Her Excellency, the First Lady, Dr. Mrs. Claudiana Ibijoke. I will put a name I know, Karena Sowolu. Thank you. Deputy Dr. Mrs. Oluremi Hamzat. Thank you. Organizing committee, Professor Adeyeye, who is my good friend, when in medical school, University of Lagos together. Thank you. Dr. Osanyitolu, who has been calling me. Thank you. Members of the organizing committee, I say thank you. Now, council members, my elders, I say thank you. And say thank you to every other person on this platform who took time out to listen, both our men. I say thank you. Thank you to everybody. God bless you.
Wow. Thank you so much, Ma. Thank you very, very, very much for this insightful session, Ma. I'm sure some of us have questions for Dr. Fagorala. Would like maybe a few of them. We can take a few questions, and if there is any other additional question, we'll definitely forward to you, Ma. So if there's anyone that has a question, please signify by raising up your hand, and let's have it so that we can be better enlightened. Thank you very much, Ma. Everyone has been saying thank you in the chat room.
Okay, sorry. Thank you.
Thank you. Very insightful, wonderful presentation. Thank you.
Thank you.
So I'm sure we all appreciate this lovely podcast. I know it's a topic we don't discuss normally. It's not something that would, people of our age will kind of just bring out and talk about, but I'm happy really, you really trashed this topic, Ma, for us. So if there's any question from anyone, please let us know so that Dr. Fagorala can address it. And any question? Okay, so someone wants to know if you will still be having periods after improvising on the estrogen and progesterone. Would you still be having periods?
No, if you're menopausal,
yes,
you won't. We put on those medications. Those are the things we use for hormone replacement therapy. No, you will not have that. We don't. But for those who are not menopausal, there's stages of menopause. We have the pre-menopause, the transition period, and that's the perimenopause, and then you have the menopause, and then you have the post-menopause. So it depends on which stage you are in.
So, Ma, can you please tell us when exactly a woman is menopausal?
Menopausal. Thank you. I was going to go there. Now, a woman is menopausal when she has missed her period for 12 months consecutively. Until you get to that stage, you are not yet menopausal. As I said, let me explain. There's premenopause, that's the transition period. We call it perimenopause. And then we have the menopausal area period. And then you have the post-menopause. Now, premenopause, I would say menopause starts from age 45, from age 45 to 50, 56. It starts by age 45. Sometimes you can have it earlier. We call those ones premature menopause. Now, in that perimenopause, the premenopause period, women have menses. They can have it, it disappears, or it comes for 3-4 months, then it disappears for 4 months, then it comes back again. They are not yet menopausal. It's until they have missed it for 1 full year. All stops. That is when they become menopause. Now, however, I need to warn, after missing your menses for 1 full year, and then suddenly it starts again, you must see your doctor. There's a problem. And that problem must be addressed on time before it becomes anything cancer. And I'm not joking. Please. If one is menopausal, she has missed her menses for 1 full year, 12 months. If she missed it for 6 months and then it appears again, she's not yet menopausal. She's in the premenopause area. Is that okay?
Yes,
so for those that are menopausal, and then we put on estrogen support, they don't bleed. because
Okay,
there are a lot of hormones involved. FSH, follicular hormone, everything is involved. The follicular stimulating hormone, luteinizing hormone, so they don't bleed. But the estrogen, we also, please note, because you know everything is online now. Don't go and buy those medications and use yourself, because unsupervised, if you're using estrogens when you become menopausal, unsupervised, and use it for a prolonged time, you are switching yourself into cancer. There is a cancer we can have in the womb, endometrial cancer. You are predisposing yourself to endometrial cancer or cervical cancer. So it's best we use it. There's a way we give it and stop. We give, we stop.
Thank you, ma. So, Professor Adeyeye would like to know the precautions you need to take when placed on HRT, hormone replacement therapy, ma.
Okay. Now, there are some precautions we take, and I've already mentioned some of it. You can't be on it for a prolonged period. And then you need to see the gynecologist regularly, because we need to be running some tests. As I said, those estrogen supports too are risky for certain things. So a woman must go back, pap smear, we can run some other tumor markers and all that. And then we can also run the simple, vaginal swabs just to check that the person is not now having some infection in the vagina. And I'm talking not serious infection, I'm talking candidiasis and all that. So those are little precautions we have to take when you're on HRT. We also assess people, because HRT predisposes them to cardiovascular problems, heart disease. So we need to see them, we can see them, we can send them to a cardiologist if we notice some symptoms. They might need to do ECG, their blood tests they can do for the cardiac, for the heart. So there's so many things. Once you're on HRT, you don't stay alone like that. You have to be seeing your doctor, see both the gynecologist and the physician.
Okay, ma'am. So someone wants to know what age a woman experiences dementia.
We're seeing that in the older, elderly people now. Many of it is hidden. I'm being blunt. It's happening now. I can't give you, that's not my field. Like, I know when I say older people, I think above age 70, we're seeing, above age 80, we're seeing just why this irrational behavior. This one is unnecessarily difficult and just doing things way out. And then we're seeing Alzheimer's, extreme forgetfulness. Now, I must mention so that nobody gets worried. One of the symptoms of menopause is forgetfulness. We have that. There are other symptoms in menopause, forgetfulness, but it's not that bad. Forgetfulness, so just flow with it. For example, like your example, when I cooked, there was a day I cooked my husband. When I finished cooking, he go enter the kitchen. I'm like, what are you looking for? He said, because you sometimes leave the gas on. I'm telling you, it happened to me. So we'll just be more careful. Once you know menopause, you can be a bit forgetful, but it's not that bad. Okay. Also, other symptoms in menopause, we have inability to sleep at night. We have insomnia. We had hot flashes. You'll be excessively sweating. I'm always changing my vest in the house. I use like 3 vests. Excessive sweating, hot flashes is all normal, but it stops. But sometimes it takes different years in different women. That's the truth. You can be on for 10, 14 years. That's the truth.
Okay, so ma, would you recommend HRT for any woman?
Now, who asked that question? I'll tell you something. I know for her to ask, she has noticed that. Now, I noticed that we black women, we usually don't talk, especially us Africans, we don't complain much about menopause symptoms, because we accept it that it's normal, it's a normal thing that will occur. So most times we don't even come to see the gynecologist to complain. But it's just now a few are now talking about it. So HRT is available, but I prefer to counsel first. I'll counsel the patient. And it's all about adjusting and understanding. And then I'll also talk to the husband. I usually do that. I notice that this is what's happening. That's why she's like this. She's going to also in menopause, mood swings. We get very irritable easily. So once you have talked about, the man knows that when the man just changes their hair, they don't say that menopause, he won't fight her. So it's all about knowing these things, educating both men and women about it, and then adjusting. The one I usually treat for is the vaginal dryness, because sex is still important. Your marriage is good to still have sex, but it might not be as frequent, which I explained. It's important the man knows that it's not like before. And then you give her the estrogen cream to use, but that is also under supervision. I give for just a few months and I stop it. Okay, and get the woman like other lubricants person can get. The hormone replacement therapy is available. I don't use it because I don't have so many people coming to me complaining, but because of also the risk of the complications, that can be a trigger for cancer and other health problems, cardiovascular problems and all that. Same thing for the men, just like the Viagra and all the different stimulants. Many of them actually buy by themselves, which is wrong. Yeah, there's a way you have to use it. You don't have to use it every day. And that's why sometimes you hear stories, the man collapsed on the woman. The people hide it. It's all these stimulants. So it should be used under simulation, under supervision. And the urologists are good at that. Once they told you, this medication, only use it once a week, and then don't use it every day. That's all. And then you can't use it for more than how many months. When you use it for like 2 months, you stop, then use it again. It's all about supervision. All the drugs are there in the market and people just go and buy. It's a danger because it's going to affect their hearts. That's true. But they are available.
Okay, ma. Thank you very much, ma. So in terms of the andropause for men, how would you recommend the women? Because most of us on this platform are women. How do you want us to support, our husbands, when they get to this point in their lives that, they kind of feel, I think they feel very
I don't. Yeah, it affects them, their ego.
And you see them chasing their wives.
When they're having
chasing and suspecting their wives everywhere. So
yeah.
I don't know.
When they have, it's all about talking. As I said, it's all about communication. They must talk. People don't talk. You don't want to talk about sex. Say it as it is. Many men, it affects their ego a lot when they're having poor erection and they're having premature ejaculation. It's all about you sitting there, this thing they say is part of it. Don't worry. Okay, see urologist, at least let urologist do it, but we will go there, enjoy ourselves. But I mentioned something that it's not until you have intercourse that sexual health is complete. No, I talked about hugging, touching, rubbing, massaging. I hope you understand all that. We're all married women. Okay? And then the man should tell you the one he likes when you're doing it, and you do it more. Just like the woman too. The man can just be massaging your breast or something, and you like it, say it. We've got past that stage where we keep quiet. When I handle young couples, these are things I tell them. When he touches you there, tell him what you like. And they're going to take time doing that. We have to talk about foreplay, increase this foreplay length. Look, I've handled young. You shock you. 6 months marriage, they can't have sex. 1 year. There was one that's in a doctor. We just got talking, and she said, I sat her down. It's okay. This is how. Tell your husband, I want to see the two of each together. It's happening, mothers. It is. You don't know. They won't tell you. I think it's enough.
Thank you very much, ma. So if there are any other questions, I'll definitely forward to you and share with every other person. Thank you, ma. So I don't know, can we, Ms. Olorunrinu, please, ma, can we take the post-test? Is it possible to take the post-test questions now? Thank you, ma. So please, can we attempt these 5 questions? I know we couldn't do the pre, but let's try the post based on the podcast that we just had.
There's a question I'm seeing. I'm going to answer this question very fast. How do you tackle incontinence in menopause? Yes, it's quite common now. And the important thing is we see the urologist. Now, we also have, please note, everybody, we also have urogynecologists now. We're having a subspecialty in gynae concerning urology. It's called urogynecologists. We have in LASUT, we have in UCH. They have been trained to handle all this incontinence problem. Please, there's no shame in it. There's Dr. Akinlusi. She's in LASUT, decent, lovely lady. We can access her. If anybody needs her, send a message to me. I'll give you her phone number. Urogynecology. They handle the incontinence aspect. It's common. And little things I can say is, once we notice that, always never keep your bladder full. Always go and urinate frequently. For example, when you get to a party, before you start the party, just use the loo first, and then sit down and chop and enjoy yourself. And before going home, knowing that you are going to sit inside long traffic, go and use the loo. Little things like that. Don't let your bladder fill up for too long. So because some people now reduce their fluid intake. No, don't do that. There are other things, but there are other things that can be done. There can be some insertion, rings inserted. But you know, all that is handled by the urogynecologist. It's something that is sorted out. For example, I'll give you an example. Somebody called me, an elderly woman, middle of the night, and she was having terrible itching, pain, and all that. And what happens is urine leaks out. So all that vulva area is now having a pain and tenderness. What did I prescribe? Vaseline cream. Just rub it on the outside. And that helped. Or you know this pseudo cream we use for babies? Just rub it there because that is amniotic dermatitis, when urine's always there, leaking there. So, but it is handled by the urogynecology. They are available in country now. Thank you.
Thank you, Ma. So I hope we're all attempting the 5 questions. Let's try to answer all the questions. So we have just a minute to do that. Jesus. Thank you. Thank you for attempting the questions. Thank you very much, Ma. So I think we can call it a day. So on behalf of Her Excellency, the First Lady of Lagos State, Dr. Claudiana Ibijoke Sanwo-Olu, the wife of the Deputy Governor, Chief Olurunrinu Hamzat, the think tank, medical think tank committee team lead, Professor Olufunke Adeyeye, and all the members, together with all the council members, we want to say a very big thank you to you, Ma, for this lovely, insightful session that we just had this evening. We want to appreciate you, and I know that anytime we need you, we can always call on you, Ma. Thank you so much for a job well done. Thank you. I know it was stressful, but I'm sorry for really putting a lot of stress on you. I'm sorry, Ma. Thank you very much, man. Thank you, everyone, for coming to join us this evening. We appreciate you and we thank you. And next month promises to be another lovely session. It's another coping mechanism, coping health mechanism. And I'm sure we will not disappoint you. Thank you very much, Ma, and have a lovely night rest. Thank you, Ma.
Thank you.
Thank you, Ma. Thank you.
Thank you, everyone.
Thank you.
Thank you,
Madam.
Thank you, Ma.
Thank you, Ma.
Thank you so much, Ma.
Thank you, Ma. God bless you, Ma.
Thank you. Bye. We are so
Starting lecture. We appreciate you, Ma.
Thank you, Ma. We appreciate you. Correct.
Thank you, Ma. Thank you, Ma.
Everyone. Correct.
That's very good. Thank you, Ma. Thank you, Ma.